Thanks so much. Important information there. The strands on the healthcare system in Southeast Texas mean a heavy demand for fresh nurses. One health company is meeting that need at its own facilities by bringing in hundreds of nurses from all over the country. Joining us now on the phone, HCA Healthcare Chief Nurse Executive for the Gulf Coast, Kelli Nations. Good morning, Kelli. You say you brought together 200 nurses from around the country. What's their top priority?
Yes, sir. Their top priority is to join our hospitals here in the Gulf Coast Division to ensure that our nurses who have been working tirelessly during the storm, to give them some relief so that they can get home and check on their families and home.
So in places like Beaumont, where we're hearing basically they have no water, how does that complicate things as far as disease and illnesses that you all may see when you respond?
Yes, ma'am. When the patients do not have any water, I mean, that really makes their home life obviously very difficult. So here in HCA Gulf Coast Division, we really worked to have preventative measures to ensure that our patients had water in the facility. So we stationed water tanks and generators around the facilities prior to the storm.
Of course, also in Beaumont, there are hospital evacuations going on. They're paused overnight and early this morning, should resume again once the sun comes up. How concerned are you about the most sensitive patients, in particular the NICU patients and their health already tenuous, now evacuating and trying to find other hospitals around the region?
Yes, sir. Those most critical patients are really a concern to our healthcare system, and the key is to get them out as quickly as possible and to transfer them as safely as possible. And here in the Gulf Coast Division, we did a lot of what we call decompression prior to the storm to transfer those patients out prior to the storm.
And of course, on your screen, we're seeing some before and after shots there, before the storm, after the storm. I want to ask you about what are you expecting to see as far as on the ground there, illnesses. Give us specifics. What sort of infections or illnesses will result? We've been talking about this area of Texas, highly concentrated with a lot of chemical plants, Superfund sites, things of that sort. So what are you expecting?
Yes, ma'am. Right now in our emergency rooms, we're seeing a lot of the individuals that have chronic diseases that are presenting that have been without medical care. So, for example, we are seeing patients with dialysis that need dialysis, individuals with chronic diseases such as COPD and heart failure. So those individuals are presenting with exacerbated illnesses, as well as we are preparing and continue to prepare. We still have our command center in place to continue to watch what's happening with our plants here in the Houston area.
We mentioned the 200 nurses you brought together. What are the resources you need for those people out there that want to help groups like yours?
Yes, sir. We have an organization within HCA that is helping us recruit these nurses, and the great thing is because of our resources with HCA, we are able to ensure that they're meeting the same rigorous standards that our nurses are within our organization. And we have nurses from all specialties: labor and delivery, neonatal ICU, trauma, medical, surgical. Really, we have everything covered.
That's great.
And do you have enough manpower? I mean, we just see how many people are in need. Do you have the manpower that you need right now?
Yes, ma'am, we really do. HCA has just done such a fabulous job of supporting us from a corporate division and local level that we have over 200 nurses that have been brought in by buses, planes, helicopters, and we're really doing quite well with staff.
Okay. The HCA is all over it, on top of it there in the Houston area. Kelli Nations, the Chief Nurse Executive there for the HCA. Thanks so much for joining us this morning. We appreciate what you're doing.